Welcome, everyone, to the Pockets of Knowledge podcast. I'm Desiree Stanley, and with me today is my guest, Cathie Gillespie. Welcome, Cathie. Thank you for coming on the show.
Hi, thank you. Thank you, Desiree. Thanks for having me.
I am so excited to have you on the show today to talk about something that is very important to me as a runner, and that's physical therapy.
Yes.
One of the things I'm excited also to talk about later is what to do when you're having some of these typical injuries, right?
Right.
So
Totally.
before we dive into that, I want to just get a little bit more information about you and your background. How
Okay.
is it that you got started in physical therapy? What drew you to it?
Yeah, very interesting. So I grew up in Colorado. So I'm a mountain girl at heart. I was at Colorado State University and I was studying exercise science and sports medicine. Initially, when I first began college, I was in the oceanography program. So you can sense in Fort Collins, Colorado, they didn't really have a great oceanography, but I had wanted to study like marine biology and things like that. I took my first oceanography class and hated it. Just did not mesh with me. And I'm in Colorado, so I didn't know anything about the ocean, and it was all studying about that. And I didn't like it. So I switched. I looked into exercise science and sports medicine. And that intrigued me because it was more like sciencey, biology, anatomy, things like that, and exercise, which I enjoy doing. Went into that field. So I graduated with exercise science and sports medicine. Within that major, basically you had to pick something pre-med or pre-nursing, pre-dental, whatever it was. I saw physical therapy. Did not know what it was about, had no clue. I had never had injuries or anything like that. And then I signed up for like an observation type thing at an outpatient clinic, went there and just really liked it. I thought, oh, this is cool. You get to help people. I wasn't sitting at a desk, it was active. So then I just ran with that. So graduated 1992 and then moved to San Diego with two of my girlfriends that were pre-nursing, and one of my other best friends, she was going into physician assistant. She was looking into physical therapy as well, but she changed her mind and went to physician assistant. So all of us medical girls relocated to San Diego. It was just going to be like a year kind of a thing, have fun while we apply to graduate schools and whatnot. And then I've been here for 30 years. So I didn't leave. But anyways, I got a job in a PT clinic, applied to graduate school. So I went to, it's now called Western University of Health Sciences, which is located in Pomona, California. Graduated in 1997 and then just been doing physical therapy ever since. So, and I love it. It's a great field. It's changed over the years for sure, but it's a great field, especially for women because it's very flexible, and especially being a mom with kids, and you can work, as much as you want or as little as you want, different avenues. So
excellent. And so can you tell us what areas of physical therapy you've worked in over these years?
Yeah, so primarily outpatient orthopedic, which that's probably my most favorite, but I have done a little bit of inpatient as well, like working in hospital settings, skilled nursing facilities, and a little bit of home health too, which is, nice. So I've seen it all, which has helped me also within working in outpatient orthopedic, because when you're working with people, you've got all different levels of, fitness, of education, or just injuries. You can really educate your patient in all different ways, But my most favorite is outpatient orthopedic. And I've worked with geriatrics and high school kids and athletes. So it's been really fun.
It sounds like you really have had kind of a cross-generational opportunity to work with people, just all ages, kind of a variety of settings.
Yeah.
And so that sounds like it would be interesting. It would keep you, constantly interested and learning and teaching.
Well, and then, that's the thing about physical therapy is that each person that you get, because you see multiple patients a day, so each person that you come across your schedule has a different injury or not even an injury, sometimes it's someone with like Parkinson's or a neurological issue as well. Sometimes you're working with someone that has a total knee and Parkinson's, it's like, so you have to figure it all out and what works for that individual person. But that's what makes it fun in the long run because each person's different. And so your mind is constantly thinking of, okay, well, how am I going to get this person to where they need to go? And then also you've got some patients that are more compliant than others. So that's always an issue. No, but yeah, it's been, I think when I first started in physical therapy, I had the opportunity to work with more seniors. And that's pretty really helped me because working with the senior population, they are so grateful for what you do, just simple things like helping them get in and out of the car or on and off their chair or resuming their like hiking or tennis or whatever that they're doing. And they're so grateful and they do their exercises. And so it's been fun working with that population. And then recently I've just kind of switched over to where I'm seeing a lot more high school kids. And that's been fun too with their sports and they want to get back on the field. They'll do their exercises as well and really listen and learn. And then that's rewarding too, because then you see meet their goals even faster. And then you get to do more fun, functional, like harder things for them. And it's very rewarding. It's been good.
It sounds like there's some definite motivation there, especially with the kids, right? They're super motivated to get better so they can get back at what they are enjoying doing.
Right.
And I'm sure even with the seniors too, that they're motivated because who wants to be just sitting in their chair all day and not doing the activities that they once enjoyed doing, right?
Right. And with seniors, as we age, you have so many more issues, excuse me, as far as like joint, we've got arthritis that comes into play. Like I said, any other neurological issues, which can make it difficult. So you really have to modify a lot more with that population as far as, their function or what realistically that person can get back to. But if you're dealing with like an active senior, you just have to, and you have to be realistic to the patient too and say, hey, this is what I think we can get there, but you're going to have to, we can modify with certain things, or you have to work on the strengthening as much as you can to get where you want to go, and balance. Balance is another huge thing. So
absolutely. Yeah. And one of my previous guests was talking about Pilates. She's been a Pilates instructor for a number of years. And, that's a huge thing is the balance that you gain from doing Pilates. And I know we were talking before about that's something that you've kind of been doing as well, right? As one of the things for your own physical well-being is doing the Pilates.
Yes. So the other thing with being a physical therapist, you have to take loads of continuing education courses. So I've taken Pilates courses, and that's what kind of introduced me to just the basics of Pilates. But I could take what I learned and apply it to myself and then also to my patients. And that's what I have really enjoyed also. And all different age groups too, to my seniors, to my high school kids, to my working moms, dads, whatever. You can just apply that across the board. And it's a great tool to get, some flexibility, core stability, because so many people lack core stability and they don't know how to engage. And they think, oh, I just have to do crunches and I have to do all this other stuff. And you don't, you can teach it in different ways. And Pilates has been a great avenue for that. And that's the other thing that I like with how I've changed with my treatment strategies with my patients is, you go to school and you learn this and this and that. And you kind of come out and you don't really know what you're doing, and you're just like, I'm just going to try, this is what this is what they said I have to do. But it doesn't apply. It doesn't work for everyone. So you have your big bag of tricks and you just keep pulling them out and see what works for the most people. And I'd say over the years, I've gone from these standards of what we've been taught in school to where I have more tools in my bag that I can just apply, to my patients. So that includes Pilates. I do yoga as well, strength training, any balance. I incorporate balance in all of my patients, not just seniors, everybody. And then obviously physical therapy is a lot of hands-on work too, as far as like joint mobilizations and stretching and soft tissue work. So it's a lot, but it's fun.
It sounds like it is. And that you enjoy it as well. That's apparent.
I do. For sure. Yeah, I do. So, I like helping people, get out of pain or improve their function or whatever it is that they need. And so it's really rewarding. It's a great profession.
That's excellent. And I know also part of your journey has been starting your own physical therapy practice. So tell us a little bit about that.
Well, this is just kind of a side gig, really. Kind of going backwards, Brian, who's my husband, I actually met him through physical therapy many, many, many years ago. And he was one of my patients. So it's kind of funny. We ended up getting married, and then we ended up becoming partners in a facility with another set of therapists, and we owned that for a good amount of years. And this was a huge endeavor. It was a big outpatient orthopedic place and a fitness center, and it was a lot, but I learned a lot. We kind of sold that and took some time off with the kids and everything. And then when COVID hit, just like everybody, just kind of sitting around, thinking, gosh, I have all this time. What can I do? And I have a skill. So I decided maybe open up a side business. That's what I did. And also, once people find out you're a PT, I started treating some of my friends and, at the house or whatever. And then that kind of just spurred onto, I have another therapist friend that she had some space, and I was helping her with some of her patients. She just said, hey, I've got an extra room if you want to kind of rent it out. And I said, sure. So that's how my little PT practice came about. And it's very small. It's very boutique-ish, I guess you could say. It's different than a regular clinic, but self-pay basically. So I do not take insurance. And that's another thing that has developed over the years as I've been practicing too, as far as insurance changes with the healthcare. It's been a whole change of that. There's a lot of people that are very in tune, and they want to help themselves out, or they've been to physical therapy before, didn't really get anywhere. And so they've sought me out, or friends have referred and whatnot. And then they get better faster.
That's awesome.
Yeah.
I love it. Well, what are the most frequent ailments that you see when you're treating these clients?
Well, it all varies. It really does. I do work for another physician too. I have a physician I work with, and he refers me some of his patients. And most of them, actually, since the pandemic, I've seen a whole shift. So people started doing home gyms and home office, right? And so there was a lot of random injuries, like people beginning their exercise programs, but they were over exercising. So they were getting all these strains, and then a lot of postural issues because they're sitting at their desks incorrectly, or makeshifting desks, or sitting on the couch, doing things like that, which over time has led into other issues as far as, because gyms weren't closed, some people just didn't work out. So then they've got weaknesses that have led to a lot of strains. So just basic muscle strains, a lot of back pain. That's probably the number one complaint. Always back pain.
I believe
low back pain, neck pain. And it all comes down to posture, really strengthening, being aware of your mechanics, which so many people are not, and in all areas as well. Seniors, middle-aged people, and even in our teenagers with back pain, because now they're carrying these big, heavy backpacks with computers.
Right.
And they're on their phones constantly,
Right.
So it's interesting to see the shifts just because of our society as well.
Yeah, that's a great point that you just brought up. The kids, with their phones, and they're looking down at their phones. And what is it about the weight of the head when you start to angle it, how it gets heavier,
right,
the further you look down.
Exactly.
And when they're looking down at their phones, their head weighs way more than normal.
Yeah.
What's it doing to their neck?
Well, yeah, that's exactly it. The average size of the head, the weight is 10 pounds. So it's like a bowling ball, and it puts strain. And with kids, when we're younger, we have so much more flexibility, right? But not a whole lot of stability. So yeah, it just leads to neck strains, postural issues. And when you're younger, you can kind of get out of that a little bit, you can at least reverse some of your curvatures. But there comes a point in time that doesn't reverse as you get older, and then you get stiff, and then you're stuck there.
So that's a great point too, is that because we are older, we need to be aware of those things. And so even for us as adults, when we're looking at our phones, we need to remember not to be looking down. So our heads, hanging down.
Exactly. And that's a lot of my job is education. constantly educating patients about their posture and where they should be sitting and standing, driving, sleeping, everything we do. And if you're not, like, the average person isn't aware of any of that, right?
Yeah.
You just go through your motions of your day and, you think you're doing okay. And then when things hurt, and if you don't have the knowledge, you just still get into those positions or compensate, and then it spirals. So yeah, a lot of my days just not only instructing people what to do, but education. Hopefully, if they don't continue exercises, they can remember my voice in their head of telling them to get taller.
That's a good point. Yeah. Well, and so talking about aging, what are some important things that, as we're reaching menopause and getting older, some of the things that women need to remember and be doing to strengthen?
That's a huge component in women as they reach menopause age. And I turned 52 this year. So I've seen things in my own body that are changing, which I didn't even know that related to menopause. Some of it, hormonal changes. It's very interesting. When, especially with women reaching menopausal age, because of the estrogen depletion and the hormones, we tend to lose muscle mass very quickly. And so weight training is really important for women and men too, especially, as we get older, not only because of the hormonal changes, but also when you weight train, you are not only increasing your muscle mass, but you're improving your bone strength and collagen strength, tendon strength. It helps decrease your risk of injuries, falling. And so many seniors, after you retire, so many people just don't do anything and you become sedentary, and everything just declines after that. Staying active, weight training, and your diet as well is really important. But for my women clients, I really stress a lot about doing some sort of weight training or body weight resistance. And it doesn't have to be a lot. You don't have to go to the gym and really work out heavy weights. You can do the resistant bands or any weight bearing exercises and just keep your muscle mass. And for bone health as well, osteoporosis, because that leads to falls and fractures.
And those falls and fractures lead to so many other issues, right? Because the healing process is not the same as we are older. So very often you're not healing properly, or it's, takes a long time, and then it just kind of snowballs, right?
Oh, definitely. Yeah, for sure. We get into menopause like in our 50s and retirement age in our 60s and still stay active. But once you get into your 70s and 80s, predominantly in your 80s, your fall risk increases. That's why you want to continue your strength training and staying healthy. Once in our 80s, our body starts declining too. Just everything kind of starts aging too. Increase of fall risk goes up. And that's when you, like I tell a lot of my older ones in their 80s, if they've got poor balance, it's like, you've got to get this going, because if you fall and break a hip and then you end up in a nursing home, it's harder for you to get out. And they don't like to hear that, but you have to be honest. So
yeah, absolutely. You're right. It's really no benefit to them to sugarcoat any of this, or don't give them the hard facts of the situation.
Yeah. It's just frustrating too sometimes, because I've worked with a lot of seniors, just with our insurance and the healthcare. And that's one of the reasons why I also kind of started my own little side biz, is because I see my patients for an hour at a time, and it's just one-on-one. So they really get a lot of good sessions, really. I work on a lot of things in an hour, and I only see them once a week, and they get better faster. Over time, as I've been practicing, I've seen a lot of shift and changes with the insurance companies as far as, and the treatments for physical therapy clinics, to be able to see them for maybe 45 minutes or a half hour. And now clinics are seeing like 3 patients to an hour or 4, and they're just, and I should say not every facility is like that, but because insurances have dropped in their reimbursements, it has changed the way PTs, and any medical facility really is treating. You're just kind of pushed through. Some of these seniors coming through, they need the extra time. It takes them a while to even walk from the front door to the table. Some patients. So they need that extra time, and they need to be educated, because in that generation, they didn't, like, no one really told them, oh yeah, you still have to be active and keep up your muscle mass,
Right.
So, yeah.
And I'm glad you brought up the point about not needing to do like heavy lifting necessarily of these weights, that even just simple resistance bands or body weight will do the trick, for some as well. Obviously, the younger you are, you could go a little bit heavier in your weights, right? But the older that you are, even just simple body weight or those resistance bands are beneficial.
Yeah, it's totally fine. Yeah. And working on balance. Balance is really important.
Yeah. So what is the most important factor, do you think, that you try to share with your clients?
Like I said, I do a lot of education. A lot of it for me is just instilling, just being motivating for them, and being, a lot of my patients, I just say, don't give up. You can still, even after our sessions are over, you still have to continue what we've talked about and take time for yourself, really become aware of your body. It's just a lot of like self-instruction and self-evaluation, really. And a lot of them, it's funny because I'll have repeat clients come in, and a lot of them will say, I hear your voice, they'll say, they'll remember things that I've told them. And it makes me feel good, because that's the things I want them to leave with, is the little snippets of information that I give them, just that sticks in their brain, whatever it is, just whatever educational tidbits that I can give them.
Awesome. All right. Now, to get a little bit personal and a little selfish for me, because I mentioned at the beginning of the show, I am a runner, and I do experience injuries myself. In fact, right now, I'm currently having some hamstring and glute issues, is just bugging me. So talk us through that a little bit. Like, what's happening with the hamstring and the glute and the piriformis as a runner, and also someone who sits at a desk all day?
Well, I haven't really seen you. That could probably, it sounds kind of nervy to me, like from your back, maybe, everything's all connected. If it's not true, I do see a lot of runners as well. I'll tell you this, the key components for any type of really strengthening for anybody is core, specifically in those oblique muscles and your glutes, not the hip extension so much as the big one, the gluteus maximus, but the little guy, the gluteus medius. And so many people are weak in that. And that's the one where if you stand on your leg and you do your leg out to the side, kind of like that action, that works that muscle. But in runners, a lot of times you're weak on that, because when you're running, you go on one leg, kind of at a time. And when you're on that one leg, that muscle needs to work and stabilize your pelvis. And if it's weak, you get or if it fatigues, you start kind of shifting your gait a little bit, then it can lead to other issues, really. But I bet that's probably, maybe tune up your buns a little bit.
That's awesome. Thank you so much, Cathie. I appreciate that. And I think you're right. I think that I do need to work on those kind of side leg swings and strengthen that. Definitely probably need to do more weight training. But
because you still run miles and miles, right? You're long. Yeah. Do you do any weight training?
I do just very minimal weight training, just like once a week. And so it's probably not enough. My miles have come down a little bit since I'm dealing with this injury, and not doing some of those longer, trail runs and ultras and stuff that I was doing a number of years ago. Yeah, I've got to get my weight training up, I think, a little bit to kind of compensate and help me strengthen my core and my glutes, as you said, and all of that. So thank you for sharing that. Let's move on now to what you would say your thoughts are on how the different treatments have evolved over time. Like, are you seeing a difference in how you're treating patients?
Yes, for sure. Like I stated, when I first graduated, it was more of like this little regimen that you kind of taught what you would do. Over time, as I've practiced and basically touched a lot of people and treated so many different diagnoses, I have more tools in my bag. So I used to do a lot what we call manual therapy. So I'd spend about 30 minutes with my patients just doing all the manual work. And that was tough on my hands, myself too, and my body. So that's a lot of like if you have a stiff joint or just whatever, mobilizations and stretching. And then I would do a little exercise in my room, and then I would just cast them aside and they'd go see like the technician who would do all of the exercising. And now over time, because I've had the luxury of seeing patients now at an hour each visit for 60 minutes. I actually do, and what I found is I do a lot less manual work. I do maybe 10, 15 minutes of it. And then the rest is a lot of exercise. Mm-hmm. And I've seen a shift in that and how people do get better faster, because we're really targeting the strengthening. And then I'm doing it with them. I'm not sending them to my assistant or technician, and I don't even see what they're doing. Now I'm supervising it and telling them so I can correct them, and I can tell them, oh, this band's too hard, or resistance is too hard. So let's switch this up. And, I can tweak them and point things out. And I think that's so much more beneficial to the patient and for myself too, because I feel like, okay, we're getting, there's follow through, and I can see what's going on and they're improving. So I'd probably say that I don't do as much manual work anymore. And it's been good. It's been really good. I was a little afraid to do that because as a manual therapist and orthopedic therapist, that's what you do. You put your hands on people. And I still do it, but just it's not as in depth.
Well, it sounds like because you're able to spend more time with someone, and you're really walking them through these exercises that they need to be doing, you can correct them as you're mm-hmm. seeing them do it to make sure they're doing it right. And then they're going to be doing it properly. So they're going to see a benefit faster, right?
Right, exactly. Yeah. And it's interesting because so many people have been to therapy before, and then they come to me and I get comments a lot of like, oh, my therapist never did that to me, or I never learned that. So again, that makes me feel good too, because they're getting a bang for their buck. And that's what you want. You want them to get better and not have to come back.
Absolutely. You're sort of working yourself out of a job in a way, but
I know.
But that's okay because that is the job, right?
Sometimes they come back for different things, but
And so you said you started this kind of, you're calling it like little side biz, to have the flexibility for your family.
Yes.
And so how has that been?
It's been really good, actually. It's perfect. I'm not like super busy. It's right. So to be honest, I have like 3 jobs. So I do work at a little clinic twice a week. And then I have my side business. And then I also treat for my friend of mine. So I see some of her patients also. So it all meshes well because it's super flexible where I can, take time off if I need to, and be with the girls or do vacations or whatnot. The side business, it was really interesting. It really was just kind of on a whim, but it's turned out really positive, and it's actually given me confidence too, because it's kind of scary putting yourself out there, and we had owned a business before, but it was just different. This was just really like, well, I guess I'll just do it, but it's turned out positive. The flexibility's been good. The feedback's been good. I see a lot of people just locally in my community, which has been really fun for me too. And I think people like that because they know me, they feel comfortable with me, they send their kids to me. And it's fun for me. It's fun because I can relate to the teens. We talk about school or sports and they like coming to me. So that's good. And they get better. So
awesome. I love it.
Although I don't treat my own kids because once I'm home, I'm a mom and I forget, my girls, they're in sports also. And sometimes they'll complain and have injuries. And then I'm like, oh yeah, whatever. And then I get harassed by them of like, why do you help me, but you help everyone else? So
that's funny.
It's funny. Yeah.
Well, to wrap up our conversation, what is maybe 1 or 2 pieces of advice that you really think that the people who are listening should know about their physical therapy, they're taking care of their body? What are some things that we really should know?
Listen to your body for one. Definitely listen to your body. If you've got a nagging pain or a strain, like your hamstring strain or whatever, things that just keep coming back, like really pay attention and listen to your body and don't just ignore it. Seek some medical medical attention and being advocate for yourself. I think this day and age with the insurances and the medical field and everything is just so, you only get seen for like 10 minutes. Just be that little pester of a bug and just listen to your body. You never know. It could just be a little thing, but sometimes it can be a big thing and it turns into a bigger thing. And then always do request physical therapy. There's a lot of physicians out there that don't know what physical therapists do or that can help with certain things. We can pretty much help with anything and everything, to be honest. And try physical therapy. That physical therapist doesn't work, just research, find someone else that will fit your need. So I'd say that. And give time to yourself. Do whatever it is, meditate or go for a walk, do something for you in your day. It'll help you in the long run and keep mental stability.
I love that. No, that you're absolutely right. That's really, we need that now coming out of these last few years, which have been really challenging. We've got to remember to give ourselves that space and time that we need. For sure.
Everything is just so fast paced, just everything in your day. You just got to take time out and you don't need a long time. Like I tell my clients, I don't send them home with 30 exercises. Like you just 15 minutes or so, just lay down on the floor, watch your Netflix show and stretch and do a few little things. And
I love it.
Keep yourself good.
Awesome. Well, thank you so much, Cathie, for coming on the show today to share this information with us and educate us a little bit. I love it. Thank you again. Just taking your time to be with us. Thank you.
Of course. Thank you so much for having me. It was really fun. Thank you.